In this module, we will discuss the three determinants for learning, namely the needs of the learner, readiness to learn, and learning styles, and how each of these determinants is critical for optimal learning to occur. Upon completion of this module, the student will be able to identify the physical therapist roles and responsibilities in teaching a patient and/or caregivers as it relates to education across the lifespan, determine the learner's readiness to learn, noting any impairments which may impact learning, assess the relevant characteristics and needs of a learner prior to the educational experience, and be able to describe the differences in learning styles and apply this information to the education of individuals across the lifespan. One of our main roles as physical therapists is to educate our patients, their caregivers, other healthcare providers, and the community to provide optimal health and wellness. The teaching and learning process begins at the time of the first encounter and continues throughout the continuum of care. To be effective in educating our clientele, we need to have a keen understanding of their baseline knowledge, their concerns and learning needs, as well as their learning styles. Once we have established this information, we can then present the information in a way in which it is readily understood by the learner. As we have discussed in the previous presentation, we can enhance learning by providing feedback and reinforcing content. There are three determinants of learning. 1, the needs of the learner. 2, readiness to learn. And 3, preferred learning styles. Over the next few slides, we will discuss each of these in further detail. Learning needs are a gap in knowledge that exists between the desired level of performance and the actual level of performance. These gaps in knowledge may exist in the cognitive, affective, and/or psychomotor domains. The purpose of the learning needs assessment is to identify who your learner is, what he or she already knows and needs to know, and how he or she best learns. Taking the time to assess the learner's needs will provide you a complete picture of your patient and will save you a lot of time and energy. Instead of focusing on what the patient already knows, you can elaborate on what the patient knows, which will keep the learner's interest, thereby increasing motivation to learn. In this slide is a list of factors to consider when performing a needs assessment. By no means is this list exhaustive, however, if you start in the right direction. Who is the learner and what information do we know about the learner? Who else is involved in the learner's care? What are the learner's needs? What educational resources are available? What is the best environment for the individual to learn? Consider time constraints. Or, if dealing with an organization, what are the demands of the organization? There are several methods one can utilize to assess learning needs. When working with patients, much of the information in regards to identifying learning needs can be obtained during the examination process when obtaining the patient's history and through observation. Patient medical records from previous episodes may also play an integral role in identifying the patient's learning needs. Additionally, family members, caregivers, and other healthcare professionals may provide additional information during formal and informal conversations. Other ways to identify learning needs used more commonly during community education initiatives include structured interviews, focus groups, self-administered questionnaires, and tests. Now that you have determined the learner's educational needs, you need to determine if the learner is able, willing, and ready to learn. If the learner is not interested or receptive to learning or does not wish to participate, learning initiatives will not be successful. In regards to readiness to learn, timing is everything. PEAK is used to assess readiness to learn. PEAK stands for physical readiness, emotional readiness, experiential readiness, and knowledge readiness. Over the next few slides, we will review each of these key factors. One aspect of readiness is physical readiness. Does the individual have the physical ability to perform the task? To determine this, you need to identify what type of skill does the task demand. Fine or gross motor, strength, flexibility, coordination. How complex is the task? Psychomotor tasks are retained best. Once ingrained, they actually become habitual. How does the environment impact learning? No matter the age of the individual, most individuals learn better in a quiet environment. How is the patient's health? As we've discussed in the previous lecture, in times of illness, patients retreat back to a lower level in Maslow's hierarchy of needs. More energy will focus on the physiological and psychological demands of the individual. Instead of focusing health education efforts on promoting health and wellness, your role when working with an acutely ill individual will be to focus on learning related to tests, treatments, and minimizing pain. In the individual with chronic illness, physiological and psychological demands will not be predictable. Individuals will go through stages of adjustment. You need to listen closely to the patient to identify when he or she is ready to learn. In regards to gender, women tend to be more receptive to medical care, taking fewer risks. When assessing emotional readiness, one needs to consider the anxiety level. Moderate level of stress is optimal for patient learning. We need to consider the patient's support system of who can help them out. The level of motivation. Motivation is defined as the time when the individual takes an active interest in learning. This is evidenced by participating and asking questions. Risk-taking. Individuals are afraid to take risks when the outcome is not guaranteed. Therefore, you want to try to minimize the risks associated. Provide the learner with the best, worst, and most probable outcome of the situation, and let the learner determine if the worst case scenario is acceptable. You also need to consider the frame of mind, which is the here and now. Individuals of lower socioeconomic class are less educated and tend to focus on immediate concerns. Once their basic needs are met, then they can focus on other needs. This is another example of how learning theory such as Maslow's hierarchy of needs affects learning. It is not until the self-actualization stage when the individual is ready to learn health promotion strategies. You also need to look at the developmental stage of the learner. Adults can draw on past experience. They'll be more willing to learn if it helps them cope better, whereas children learn best based on the basis of pleasure and comfort. Experiential readiness. How do life experiences affect the individual's ability to learn? Early success often promotes motivation to learn. Coping mechanisms, or how well the individual is able to cope, may also affect the ability to learn. It is important to keep in mind that past experiences, positive or negative, can greatly impact future learning. Cultural competence is extremely important when working with individuals from another culture. The PT should have a keen understanding of the individual's cultural beliefs in regard to illness and must integrate the client's beliefs at all times. Additionally, if the individual speaks a different language, always use a trained medical interpreter. In some cultures, health concerns and issues are very private and the individual may not want their family or friends involved. Another reason to use trained medical interpreter is because there is not a word in every language for all medical terminology. Using a trained medical interpreter ensures that the information you are conveying is being accurately relayed to the patient. It is also important to know what drives the individuals. Some individuals are internally driven, whereas others look to external motivation for learning. Orientation, parochial versus cosmopolitan. Somebody of a parochial orientation is typically somebody who's from a small town. They live in protective environments. They tend to be closed-minded and conservative, and they're less willing to learn or trust an authority figure, versus somebody who is from the cosmopolitan orientation tends to have a broader, more worldly, more receptive to new ideas. Lastly, knowledge readiness. Providing patient, client-centered care means considering the needs of the patient and client first. One way you can assess the individual's knowledge base is to ask the individual what he or she already knows and what they would like to know. Identify the educational level of the individual and ensure that you are teaching at the level of the learner. Teaching at a lower level will bore the learner, whereas teaching at a higher level may overwhelm the learner, both leading to poor outcomes. Some of the individuals you work with may have a learning and/or reading disability. However, it is important to keep in mind that learning and reading disabilities are not necessarily indicative of intelligence.